Hello, everyone. On behalf of Centers for Medicare and Medicaid Services, CMS Division of Quality Improvement and Innovation Models, in collaboration with the CMS Division of Tribal Affairs, I'd like to welcome everyone to the listening session on CMS Quality Innovation Network, Quality Improvement Organization Efforts in the AI/AN community. My name is Michaela Holm, and I work with Kaufman & Associates, and I'll be your moderator for today. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. First, the presentation slides are at the main window and the speakers will appear at the top above the presentation. At the bottom of your screen is the Zoom menu bar. Here you'll find the Q&A box. We encourage you to use this feature to submit any questions at any point during the webinar, and we'll leave time for Q&A segment to address all questions at the end. And then also at the bottom of your menu bar, you'll find a chat box. Please use the chat box to report any technical issues you may be experiencing, and we'll respond to those as they come in. Another menu option is the raised hand icon. Please use this feature if you'd like for us to unmute your line to ask questions during the Q&A segment. And additionally, live captioning is available during today's broadcast. Simply click the CC icon from your bottom menu bar to use this feature. Finally, please be aware that today's webinar is being recorded and the recording will be made available online in the near future on go.cms.gov/AIAN. With those announcements made, I would like to welcome everybody to today's webinar. I'll turn it over to Dr. Susan Carroll.
Hey, good afternoon, everyone. The Centers for Medicare and Medicaid Services, Division of Tribal Affairs, in collaboration with the CMS Center for Clinical Standards and Quality and the Quality Improvement and Innovation Group, or IQIG, are hosting this virtual listening session today to receive feedback from tribal leaders, tribal health directors, facility CEOs, and others to help CMS shape the vision for the future of CMS's quality improvement work. Examples of current quality improvement activities include programs that address patient safety, patient readmission rates, infection control and prevention, hospital-associated conditions, and quality star rating systems, among others. We also are seeking input on any unique circumstances for Indian healthcare providers and communities across the Indian healthcare system that you'd like to share and that will inform the design of this future work. To obtain your feedback and input today, we'll be using a new platform called Remesh that will offer an opportunity for all in attendance to provide responses to each of the posed questions. In order to participate in this way, you'll need to open a new web browser and register for the Remesh system. Registration is just a few simple clicks, and our next speakers will go into that in more detail. We'll try to do that for the first 20 to 30 minutes, and then we'll go back to our traditional Q&A process where you can ask questions and provide commentary for us regarding your quality work across your healthcare system. The link to the Remesh is included in today's appointment, and it's included in the save the date that went out yesterday, and it is all now posted in the chat box. So if you open up your chat box, you'll see the remesh.chat with a number of letters and numbers. If you want, click on that and start by opening up that browser. I'll now turn the webinar over to Anita Montero, Director of the Quality Improvement and Innovation Group, and her deputy Shane Eiles, who will facilitate the Remesh session and the traditional commentary section to obtain your valuable input. Anita, over to you.
Thank you, Dr. Carroll. Thank you so much for inviting us to this forum and for providing an opportunity for us to speak directly with the folks that have incredible, I know, input into shaping the kind of quality assistance, quality improvement assistance that CMS can provide. Before I get started, I want to acknowledge my team members here. Shane Elias, who is my Deputy Director of the Quality Improvement Innovation Group. Paul Rosen, who is the Director of the division that runs this program and is on vacation this week, but I see has joined us today. So thank you for joining us, Dr. Rosen. Also joined by Xuan Johnson, the Deputy Director of the division that runs this program, and Sabrina Chaktura, who is a subject matter expert and a program lead for this work. And they've all played a very critical role in not only the current work, but the future work as well. So I am truly excited to be here today to talk with you all about our approach and strategy for the future of quality improvement assistance. We are excited about the impact that we can have with to the healthcare delivery and services for over 2.5 million American Indian Alaska Natives. And we're absolutely excited about that opportunity. And I want to say first that while we have a current program that exists in terms of quality improvement that is focused on certain important areas, several things have happened that have caused us to sort of take a pause and think about the future of the program in a very intentional and strategic sense. And we want to, as we have in the past, sort of shape and co-own this program with you. I do think that in the strategy and the approach moving forward, you have a very, very tangible opportunities to shape the kind of assistance that we can provide. And so the first thing I'll say is that, the iQuality Improvement Innovation Group that you're familiar with leads all of the quality improvement programs across the country. The QIO program that you're familiar with, I'm sure, is the largest federal program dedicated to quality improvement. And our mission is to improve the quality of improve quality and safety of healthcare services for all Americans. And so that is really, really important. And that's the backdrop against which we work. Now, as I mentioned before, a few things that have happened that bring us to what I would say a very important time in history and a very important time in the evolution and the journey of the program itself, which spans a few decades. And so one of the things that we've had that we rolled out recently, and Tom, if you can move to the next slide, thank you very much, the CMS National Quality Strategy. So this is the quality strategy that was rolled out a couple of months ago at CMS. And these are the 8 goals. I'm not going to go over each one of them. Further information around this is provided on the cms.gov website. We'll be happy to send you a link as well. But these are some of the goals that CMS has developed for quality and safety. And we have an action framework internally within the agency, working with federal partners, the private sector, state and local officials to implement each one of those initiatives within these goals. So one of the things that I will, just point out here, because we'll talk about it in just a few minutes, is the second goal, which is advance health equity. As you may already know, this is one of the highest priorities for the CMS administrator, Chiquita Brooks-LaShore. And so all of our programs in CMS are focused on advancing health equity. And I believe that is really, really important, that aspect, that goal, in addition to everything else here, but that specific goal is really relevant and applicable to this population, the American Indian Alaska Native population. And so that is really important, that we want to, in shaping the program, the future of the program, we want to be able to align with all of these goals, but we definitely want to be able to advance health equity through the program. So that's one. The second goes without saying, we're all in the middle of a pandemic, right? And the pandemic has, in so many ways, just illuminated some of the flaws of the healthcare system. And healthcare systems that were already at a level of stress and already experiencing need just got worse, as a result of the pandemic and the challenges that came out of it. So we have a moral obligation as public health experts, as public health professionals, as quality improvers to pay attention to the impact of the pandemic, the challenges that exist as a result of that, and the role that we can play there. So that's second. And then the third thing I would say is that the QIO program itself is going through a process of transformation and evolution. So Tom, if you could move me to the next slide, I want to go over some of these changes with the QIO program that are absolutely going to work in your favor. In the past, the QIO program used to be a broad sort of catch-all program where QIOs were resources, across the country. And while we still continue to depend on them as resources for providers out there, in the future, we want to make sure that we're focusing those QIO resources and that funding where it's needed, based on not just the needs that are identified, but based on the data as well. And so that's a perfect match really for the American Indian Alaska Native population, because when you look at this population, you see, disproportionate disease burden, you see chronic conditions, the prevalence of chronic conditions is really high as compared to, the rest of the population in the United States. Life expectancy is 5.5 times lower than the United States all races population. There's a high prevalence of, high death rates in certain disease conditions. There are providers who could use assistance with performance. There are people with limited access to high quality care. There's providers with limited access to quality improvement resources. And there is a great need in these areas and regions to build capacity and health system resiliency. So for me and my team, this checks off all the boxes. And so I want to just quickly give you a sneak peek into some of the questions that Shane is going to be asking you all through the interactive tool, just so you're prepared, to answer some of those questions. So these are some that we're really looking for input from you all on. How has our work helped you so far? What are some current problems and challenges? What goals do you have? What are your wants and your needs? What do you find lacking in the health system? What's on your mind? What are we missing? What do your constituents, value the most? If you could change a few things about the health system, what would they be? And the next slide, please. A few more questions on this slide, just in terms of how we can partner together better to own the path forward, what's working, what's not working, what barriers you find. And so I want to, before I turn it over to Shane to sort of go into the input and hearing your voice and shaping this work, I want to provide two things that are different about our strategy this time. The body of work that you're going to weigh in on today, and I would encourage you all to reach out to colleagues who are not here, couldn't be here today, over the next 2 to 4 weeks or so, or I would say at least 2 weeks or so, feel free to send us your input by email, to Dr. Carroll, to the Division of Tribal Affairs. They'd be happy to share it with us. But here's the approach we want to take, because this work is going to begin in 2024, and it is going to take us into the next decade. So it ends at 2029. So we want to begin the next decade in a much better place than we are in this decade. So the first thing I want to say is that health issues, as a quality improver, my perspective is that health issues are not primarily just health issues. They are public health issues, they're social issues. They have a strong connection with education, with income, with housing, with food, with poverty, with access to opportunity. And so we want to look at the community as a whole, and we want to move away a little bit from the model of focusing just on facilities and hospitals and critical access hospitals, to looking at those facilities and those hospitals within the community structure as a whole. So we want to adopt the entire community as a whole, with everything that it comes with, and then work on quality improvement, either community-based interventions or very specific, facility-based interventions. So that's the first thing we want to look at. And then the second thing we want to do for sure is to create synergy within the ecosystem, I would say, in terms of the healthcare delivery. How can folks support each other better? What are some of the best practices that have worked in some facilities that maybe could work in others? And so CMS would like to partner with you to provide that technology support and that data support and that learning system to make sure that those things can happen. So those are a very exciting vision. My team is very excited about this, and I am too, and would love to hear your input in terms of how we can shape this program together. So with that, I will turn this over to Shane.
Thank you so much, Anita. So again, my name is Shane Ilias. I'm the Deputy Group Director here in CMS for the Quality Improvement and Innovation Group. As mentioned before, we're going to be using a new system called readmissions to receive valuable feedback from you that will help CMS design a future quality improvement program. So let me first give you a quick explanation of how this works. readmissions is a platform that launches a live conversation and uses real-time AI to organize and analyze responses. So how do we begin? First, I need you to open up readmissions application in order to participate. So you can find the URL in the chat, and it's also in the meeting appointment. So I'm going to pause here for about 30 seconds so everybody can jump into readmissions. Again, the readmissions application URL is in the appointment and in the chat. Go ahead and click on that. You'll be asked a couple questions just to confirm that you agree with using the system. And then you should be able to, or you should see the welcome message, and then we'll go ahead and get started. And I'm seeing already an increase in the number of folks that have registered online, so I appreciate that. Again, go into readmissions in the URL in the chat or in the meeting appointment, and we'll go ahead and get started in just another few seconds. Okay, so in readmissions, the conversation is made up of two types of questions: polls and open-ended questions. For polls, we'll ask for you to read the question, review the options, make your selection, and then submit. Once the time to answer once the set time to answer the question has expired, we'll be able to see the results from all that answered the polling question. For open-ended questions, we ask that you respond to the question in narrative form. You'll then be able to vote on other responses submitted by your colleagues. So it's important that you submit your responses fairly quickly so that you can move on to the next step. Again, we set up a time for you to answer the question and then participate in the voting. Once that time expires, we'll be able to see the input from your preferences. Again, if you haven't gone into readmissions yet, please go ahead and click on that URL in the chat, and you'll be able to actively participate in the feedback today. So as background then, now that we've had this, let's go ahead and try out a few questions in real time to get us going. Our first question today: how are you doing today? You have 30 seconds to answer this polling question. Okay, and in this time, we have 33% of you say tip-top thumbs up. 27% of you say I'm making it work. And the majority of you say you had a whirlwind week. I hope your week gets better. One day to go to the weekend. So let's go ahead and practice a narrative question. What do you like most about springtime? Okay, so springtime, blooming flowers and trees and nice weather were our top submissions, and beautiful flowers and trees blooming back to life. Love springtime. So thank you for participating in our test. So now that you can see, you answer the question, and then you'll get other responses from folks around the country, your colleagues around the country, that you can see what their thoughts were about answering the question, and you can go ahead and vote. So now that we've practiced, let's get going in asking some very specific questions about quality improvement and receiving your feedback today. So what goals do you have that we could help or assist with? Okay, thank you so much for your feedback. So 100% of you agreed spreading quality improvement across the Indian health system is most important, followed by increasing mental health resources. Lots of other answers, and we'll be able to provide all of this information back to everybody at the end of the session today. The next question we want your responses on is, what is working well in the health system? So next question, what is working well in the health system? Okay, what's working well? We have agreement. 100% of you say ability to provide in-person and virtual services. Telehealth is also a positive, and obviously providing quality services, right? So let's go on then to ask the next question. What current problems and challenges, what are your needs and wants to help with improving quality and safety? I'm sorry, I skipped a question there. What are your wants and or needs to help with improving quality and safety? Just to make sure, I think I said the wrong question, but I want to make sure you're answering the right one. What current problems and challenges do you want us to make us aware of? Apologize for the confusion. What current problems and challenges do you want to make us aware of? Okay, current problems and challenges. Staffing, high turnover, hear you. Outside provider understanding of purchase or preferred care programs, also something that's been challenging for you. Staff morale and resources, hear you. Okay, thank you so much. So my next question then is, what are your wants and or needs for help regarding quality and safety? What are your wants and or needs to help with improving quality and safety? Okay, what are your wants and needs to help with improving quality and safety? 75% say ensuring a strong quality improvement department at all IHS and tribal facilities. Also heard that you want to hold leadership accountable for quality and safety. Adequate funding and training is also important to you. Thank you. My next question. How can we partner together to own the path forward? How can we partner with you to better own the path forward? Okay, thank you so much. How we can partner together to own the path forward. We heard common topics, monthly quality improvement meetings with tribal stakeholders, also continuing listening sessions so that we can hear what issues there are, and holding sessions with tribal health clinics by state on a quarterly basis are some of your ideas. Thank you. I have one last question. What should we know about your ecosystem that will help us in quality improvement? So what should we know about quality improvement in your ecosystem? This is a great question to ask at the very end. Is there something that we're missing that we need to know about? Okay, so what should we know about quality improvement in your ecosystem? I see a lot of uniqueness, right? Where there's a lot of uniqueness and within the tribes, understanding among staff about why we even do quality improvement. So we need to do some additional work there. So I appreciate all of your comments and your active engagement today. This has been a new platform for all of you, and I appreciate your willingness to go on this journey with us. It's really important for us to hear from you in regards to what your needs are, what your barriers are, and how we can help with you on quality improvement for patient safety and quality care. This is an opportunity to share your voice today, and I know that we're going to be available after the next half of the section today to hear some additional questions and comments. And as mentioned before, feel free to reach out to your contacts. We'll get the information to us as we design a future of quality improvement. So thank you for your active engagement today. Your input is really vital. It will help us shape the future of quality improvement program for CMS. Dr. Carroll, I'll turn it back over to you. Thanks.
Great. Thanks so much, Shane. I really appreciate the remesh platform. I think it's a great way to get everybody's input. I think as time goes on and as we do more of the listening sessions and consultations, and as people get used to remesh, they'll be thinking in terms of how to answer those questions. At first, it's a little hard to jump right in there and provide your input, but I was really impressed. I really thought everybody did great. So thank you. And like you said, we're going to turn over now to our traditional way of doing our listening sessions. We'd like you to either pose your questions in the Q&A section, or we're going to use, I believe Michaela is going to help us with audible questions. And now that you've sort of got your quality brain turned on, we will let you tell us what you think of the quality programs out there, what you would like to see, and how the Indian health system is special, how it is different, and how we do need some assistance in making better quality improvement across all of the IHS tribal and urban system. So, Michaela, do you have anything to add?
Yeah, thank you, Susan. Tom, could you please pull up this question slides just so the panelists are able to view those? And then if you do have any questions, you can place those in the Q&A box at any time. It's located at the bottom of your screen, or you can use the raised hand icon and we can unmute your line as well. Again, if you have any other questions or comments, you can place them in the Q&A box at the bottom of your screen, or you can use the raise hand function and we can unmute your line.
This is Dr. Carroll. I like that last question. If you could change 3 things about your health system, what would they be? And feel free, we want to hear what you think are big issues for the care that you receive in your communities. So don't be shy. This is a great opportunity to help CMS fashion their quality work to help meet your needs.
If you have anything you would like to share, you can please put it in the Q&A box that's located on the bottom of your screen, or use your raise hand function. I think we'll give it just a couple more minutes to see if there are any comments, Dr. Susan Carroll.
And I'm going to start calling on some of our participants because I know they are truly involved with at least the Indian Health Service quality department. Juliana and who else? And I know Yvonne's very vocal, and I know, Yvonne, you've got some great ideas in there. Come on, let us hear from you.
Yes, you can. We have Yvonne, her hand is raised. And so if you could please unmute their line, Tom, thank you.
You called me out, Dr. Carroll. You know, I think the one thing that I hear consistently is to set quality measures that we can easily, that we can get through our systems. And for some of us that are still on RPMS, you know, we appreciate that we don't change up and do a collection of measures that we can't easily record and extract and submit.
So metrics.
Yes.
Metrics are tough sometimes. I know I work very hard to try to make sure that the metrics coming at you from CMS flow with the metrics of the GPRA indicators, and flow with the improving patient care metrics. So we are looking at that. And Yvonne, is your site a tribal site or an IHS site?
Tribal site.
Now, are you working with any QINs at your site that you're aware of?
Dr. Carroll, I'm on the policy side, and so I'm not as attuned to what is going on in the clinic. I just know that, that's one of the overarching things that,
Okay.
that we like to keep some consistency and ability to be able to address and be able to submit the information that is requested. And so when we work across a lot of different areas, we always request, please don't put a lot of things in that makes it difficult for us to be able to check. So I'm probably not the best, other than I just wanted to be on the call and be aware of what's going on.
I greatly appreciate you taking a few minutes here to talk with us. So thank you. And I'm going to flip it over to Juliana Sadovich, because I know she's working hard with QIO and the Indian Health Service hospitals. I don't know, Juliana, do you have the opportunity to tell us your thoughts about how that program is working?
So I think one of the best things that CMS helped IHS with first and foremost was making the PATH program so that we had a single QIO across our 24 hospitals and critical access hospitals. So that really improved communication and increased consistency in communication. I think the second thing that the PATH program really brought to IHS was their ability to work with us beyond collecting data and analysis of that data. I think CMS, I think that we tend to get focused on data and data measures and trying to collect that measures. That's always been, difficult for us. I think it's probably true for other tribal facilities and just rural facilities in general. Having the ability to really have that flexibility in our systems to collect and change measures. So that's always been hard. PATH has helped us with a number of things, but I think the real focus on setting up the focus areas that we do work with PATH and focusing more on quality improvement, not just data. Of course, you want to be able to measure to see if you did improve. But, I think that we took a step beyond, just thinking in terms of measures, but really started to think in terms of quality improvement. And they have been very helpful in helping our system with different quality improvement activities. They've been able to bring knowledge and information into the system that was a lot harder for us to get. I think those kinds of things are truly what has made the PATH program really helpful for IHS.
Thank you so much. Really appreciate that. Are there any hands up, Michaela?
There are no additional hands raised at this time.
There is a question from Jacob Dunlap to everyone. Juliana, let's see, I just lost it, sorry.
Yeah, I can read it out loud here. It's in the chat box. Who is Juliana referencing? I missed it, but would be interested.
This is Julie. I was referencing the PATH, the Partnership to Advance Tribal Health. It's a contract that CMS has, so with their QIOs, so that they were able to bring them together and give us a single QIO with the ability to, it seems to me that we, through the PATH program, have the ability to work with them in greater ways than we were able to work with the individual QIOs that our different hospitals had across the country. I think originally, before PATH, we had 5 different QIOs our hospitals were working with.
Thanks, Juliana. I want to point out the third bullet. What goals do you have that we could help you with? I think that's important because we're developing up some programs. We're thinking about what we're going to do. What would help at your facility?
If you have any comments, please place them in the Q&A chat box, or you can use your raise hand feature and we can unmute your line.
And this is Dr. Carroll again. So quality sometimes is a term that's a little ethereal, and it's sometimes it's difficult to understand, but safety is another concept that we also are trying to emphasize. How to make going to your clinic, your hospital safer. Where might we help you with that? We have a quiet crowd today. And you've all hung in there. There's still 33 people that are listening. And of course, I do not want to have to go to the list to tag some new people. How about Michael Cook? Michael, I know you're out there.
Dr. Susan Carroll, we do have one in the Q&A box I can read out. This is from Jade Barnes. I'm not sure if I am at the right listening session. This is my first time. I find outside providers have a significant lack of knowledge on the federal regulations that define tribal referrals, specifically in regards to purchased referred care program. How can CMS help train them?
It says on my sheet that Jennifer Gillison would like to answer this question live. Is that true, Jennifer?
Apologies. I just said that the question was being answered live. Please ignore that.
Oh, okay. I got it. Sorry. How can we help you with the purchase and referred care program? How to educate providers? I'm assuming that's outside providers. And I know that there are a number of individuals at IHS that can provide an excellent webinar for the purchase and referred care program. So I know I can follow up with IHS to see if they can somehow put that together to help with new providers or outside providers on the federal regulations. All right. Sabrina, you want to tell us a little bit more about the PATH program?
Sure. Can you all hear me?
Yes.
Great. So just in answering Jade's question, I know specifically, at least for the PATH program and the 24 facilities that we work with IHS, PATH really works closely with the assigned facilities to help educate, the providers who are brought into the system about how to manage, how to manage the referred care program and what benefits exist and don't exist and how to work through that. So I think we're actually seeing a lot of improvement there within PATH or within IHS. I can't speak to, the tribal facilities that we have in Task Order 3 and how that works, but I do know that PATH has been working a lot on this because I see it in their reports a lot. And so, I think if this was something that, a large group of people was interested in, we could definitely get, like you said, Dr. Crow, some sort of presentation together about even showing what projects have already been done around this, because I know there has been a good amount of work around this, especially I think in the Great Plains area.
Okay, thank you. So I can also look at the 5th bullet point. What do you find lacking in your health delivery system? Type in your answer if you'd like.
You can enter your comments in the Q&A box at the bottom of your screen if you'd like.
One of the things that I want to let everybody know is that this is the first part of a long conversation with the quality work that is ongoing at your facilities and with CMS very interested in IHS and tribal and urban organizations. We want to continue the conversation. And I can't say this is going to happen every month, but we were hoping for probably a quarterly opportunity to bring the conversation back and to have today's participants go back to their facilities, think about what we're talking about. You can always provide input to me at tribal affairs at cms.hhs.gov. That's tribal affairs, one word, at cms.hhs.gov. The CMS Division of Tribal Affairs and the Center for Clinical Standards and Quality and the Quality Improvement and Innovation Group want to really thank you for attending today. I'm going to give you a few minutes back because I know we're all busy, but please do take some time, think about what we talked about today, look at what your facility does for quality and safety, and please do let us know. Our website at CMS is go.cms.gov/AIAN. And it will have a copy of this All Tribes call in the next few weeks for you to look back at, re-review, or even to suggest that your quality team take some time to look at the questions and do provide some input to us. We will be having a virtual TTAG face-to-face meeting at the end of July. We'd like to be able to speak further with the tribal leaders that are part of TTAG, that's Tribal Technical Advisory Group for CMS. And if you have any thoughts, please do let them know about this. And we'll continue the conversation with Shane and Anita and the entire quality improvement group. Shane, anything further to add before we sign off?
I just want to again thank everybody for their time and attention today. Appreciate Dr. Carroll and all of the other folks on the line that helped facilitate behind the scenes. Again, we are here to receive your input and your ideas as we shape quality improvement for the future. So please don't be shy. We need to know what your needs are and what your best ideas are in order to move together. Appreciate all your help. Thanks.
Very good. Thanks again, everyone. Have a great afternoon.